Hey everybody, today we're covering ventricular septal defect. It is part of the pediatric series that we have been covering. We are going to be covering the nursing interventions, the signs and symptoms that's associated with VSD, the medical treatments that's involved, and the pathophysiology behind this disorder. If you haven't subscribed yet, make sure to subscribe, and also give this video a like and share it with your friends. And with all that being said, let's get started. Okay, so what is ventricular septal defect, also known as VSD? Well, VSD is an abnormal opening between the right and left ventricle. So with children, sometimes the septal wall does not close completely, and what happens is that the wall in between the right ventricle and the left ventricle remains open, and highly pressurized blood flows from the left ventricle to the right ventricle, meaning blood is flowing from an area from high resistance to least resistance. This is also known as shunting. Shunting is when a passage is present within the heart, or it could also be in other body systems, and that blood is pushed from an area of high resistance to least resistance. VSD is considered to be a left to right shunt, meaning the child will experience acyananotic signs and symptoms. They won't have any issues with cyanosis, meaning they won't have blue lips, blue extremities. They will not have any dyspnea. Their O2 status will be typically normal. The wall in between the two ventricles, also known as the intravascular septum, remains open. Typically, this wall closes when the child is born. Sometimes you get children who have this wall that remains open, and it requires medical intervention. So remember that blood flow is flowing from the left ventricle to the right ventricle, meaning the left ventricle pushes blood from the left ventricle to the right ventricle because the left ventricle naturally pushes blood out at a higher resistance. So with the intravascular septum that's open, it's going to push out blood at a high rate towards the right ventricle. The reason the child is acyanotic is because blood has already flowed from the right ventricle to the lungs, meaning the blood has already been oxygenated. If the issue is that the right ventricle is pushing blood to the left ventricle, then the child would be experiencing cyanotic signs and symptoms. But in this case, the child is acyanotic. Okay, so for the signs and symptoms associated with ventricular septal defect, so remember that high blood flow is flowing from the left ventricle to the right ventricle. Since there is highly pressurized blood flow flowing to this area, right ventricle is going to hypertrophy due to high blood flow. So for example, if you're doing a bicep workout over and over again, your bicep muscles will grow. This is going to be the same issue here because with the left ventricle, highly pressurized blood is pushing against this muscular wall. Therefore, it's going to increase in size, leading to cardiomegaly. The issue with cardiomegaly, since it is the cause of increased resistance of blood flow, it could lead to two main things: congestive heart failure and pulmonary hypertension. I will explain how pulmonary hypertension occurs, but with CHF, the reason CHF occurs is because when cardiomegaly occurs, that means the heart has to work twice as hard to push out systemic blood flow to the rest of the body. And the heart is going to become tired over time, leading into congestive heart failure. Another sign and symptom is tachycardia. The reason tachycardia occurs is because there's high resistant blood flow that is flowing from the left ventricle to the right ventricle. The third sign and symptom is deficient blood flow volume. So since blood flow is flowing from the left ventricle to the right ventricle, that means there's not going to be enough blood flow flowing out to systemic circulation because most of the blood is flowing from the left side of the heart to the right side of the heart. So we're going to see signs and symptoms of low cardiac output. So we're going to see low tissue perfusion, which leads to lactic acidosis. Some assessment skills, looking at the child's capillary refill time. So those will be some signs and symptoms of deficient cardiac output. So how does pulmonary hypertension occur? Well, it begins when the right ventricle has to pump more blood to the lungs to compensate. So what happens after that is that the pulmonary vasculature within the lungs become overloaded. In order to overcome this overload, the right ventricle has to generate higher pressure And what happens from there is that the right ventricle is now higher than the left ventricle, meaning this could lead into a reverse shunt. So VSD could switch from a left to right. Due to pulmonary hypertension, it can now lead from right to left. This is a way the body is trying to compensate for the pulmonary vasculature becoming overloaded. But don't get it confused, VSD is normally a left to right shunt. This happens if the lungs become extremely overloaded. From there, a reverse shunt could occur, meaning a right to left shunt could happen. That means the child could experience cyanotic signs and symptoms. But remember, VSD is a left to right shunt. All right, so for diagnostic testing for ventricular septal defect, one way to diagnose this order is using your stethoscope and detecting a loud murmur. By using the bell of your stethoscope, you will be able to hear a murmur. How would you hear that murmur? Well, it's because there is a hole in the chamber that causes that swooshing noise within the heart. Since there's a hole within the intravascular septum, you will be able to hear that murmur. Another way to diagnose VSD is with an ECG. So by placing some leads on the infant, you will detect whether or not the rhythm is normal or not. Another way to diagnose VSD is using a chest x-ray. A chest x-ray is going to detect cardiomegaly. So as I explained, since this is a left to right shunt, the left ventricle is pushing blood to the right ventricle. Now that right ventricular muscle is going to become hypertrophy, leading to cardiomegaly. You will be able to detect that with a chest x-ray. The best way to diagnose this disorder is with an echocardiogram. What an echocardiogram is going to do, it's going to take an image within the chambers and the ventricles of the heart to see where the actual issue is. And from there, we will be able to diagnose the actual issue. Also, something that's good about echocardiogram is that it's going to show the ejection fraction of the heart, meaning we can see if this disorder is leading to CHF, because depending on the ejection fraction, we can determine how prolonged VSD has occurred, leading to these issues. All right, so what are some treatments for VSD? Well, the first thing that's so important to do is to repair that septum, the intravascular septum, the wall in between the left ventricle and the right ventricle. So what will be ordered will be a surgical repair so we can restore that wall. Something that's important to keep a note of is that if it's caught early, there will typically not be any major long-term issues in the long run. So it's always important to catch VSD as early as possible to prevent any complications within the future. Also, another treatment is to increase caloric intake. Infants who are growing need formula or their mother's breast milk in order to grow and thrive. With this disorder, it can decrease the child's appetite. They will not be able to feed properly. So it's important to increase the caloric intake so we can keep the child's nutritional values in place. Third treatment is digoxin. Digoxin, what it does is considered to be an inotropic medication. And what it does, it increases contractility of the heart. So this is typically if VSD has led to CHF due to the issue of the heart being overworked. Something that you want to keep in mind of while giving digoxin is to draw dig levels. The reason we draw dig levels is to monitor for digoxin toxicity. So what are the signs and symptoms of digoxin toxicity? There's a mnemonic that a good friend of mine has given me. It's called Warren-Brady. How it goes is WARN for Warren and Brady, so weakness, arrhythmia, restlessness, nausea, vomiting, and bradycardia. Those signs and symptoms are something you want to keep in track of to monitor for digoxin toxicity. The fourth treatment is antibiotics. So why would antibiotics be given? If surgical repair has been placed and that intravascular septum has been closed off, restoring perfusion to the rest of the body, antibiotics need to be given before any dental procedures, so it prevents endocarditis from occurring. Any patient that has any surgical valve replacements or surgical valve repairment has to have antibiotics before going to the dentist to prevent any bacteria from growing on those valves. So that's why antibiotics are given. All right, so I hope you liked the video. If you did, make sure to like and subscribe. If you haven't, also share this video with your friends. We have covered a lot of the major issues with VSD. I mainly spoke about the pathophysiology behind this disorder. In order to understand the signs and symptoms, you need to know the patho behind it, so you can understand how the diagnostics occur and how the treatments occur as well. So with all of that being said, thank you for watching and have a great day.